Technical problem. Okay, good morning everyone. I'm Dr. Tracy and this is Dr. Ben. Thank you for joining us. Today we will be discussing about influenza vaccine. So, what is influenza?
Good morning, everyone. Welcome back again to our series of lecture. We are talking about different types of vaccines and diseases. So for today, we're going to talk about flu or influenza and flu vaccine. So what exactly is influenza? Influenza is a respiratory disease or illness that's caused by a thing called influenza virus.
流感是由一种流感病毒导致的急性呼吸道感染。How flu is spread?
You see, when we are having a flu symptoms, what are the common things that we present? We have cough, we have sneezing, we have runny nose. It's the droplets from the sneeze, from the cough. That's how the virus spread. So for example, when we cough, we cover our mouth, our nose, and with the contact in our hands, we may touch different surfaces around us. And the next person comes in, if you do not wipe or provide a good hygiene, that person may touch on those surfaces and the virus will stick into your hand. And when they touch the surface of their face or near their nose, that's how a virus spread.
当感染者在咳嗽或流喷嚏的时候，受感染的飞沫会散播。当你接触到这个散播的飞沫的时候，那么你就有机会感染到这个流感。除此之外，它也可以通过感染者的手传播这个流感。What is the difference between cold and flu?
A cold is something everyone comes and say, I have a mild runny nose. My nose is blocked. So they don't really have fever, they don't have body aches, and usually have sore throat and just stuffy nose, and usually it's very mild. You resolve with antihistamine or sometimes it go away by itself. But a flu is a bit different. The influenza virus, it affects your entire body. That's why a person that comes with the flu, most of the time they actually have fever, and usually it's quite an abrupt onset. That means quite quick comes about, and usually they have bad body aches, they have chills, they have cough, and one of the things they usually have, they feel very fatigued, they feel very tired.
OK，说感冒和流感有什么分别呢？感冒通常它的症状没有这么严重，可能你只有稍微的发烧，或者是稍微的鼻子阻塞。可是流感呢，你会在短期内拥有很严重的症状，例如整身的酸痛、高发烧、喉咙疼痛跟感冒等等。What happens when a person catch the flu?
In general, or most of the time, when a person catches a flu, they are very mild. They just present with fever, body aches, cough or runny nose, and after that, they'll resolve by itself in the next 10 days. But in certain cases, this flu actually affects the whole body system and things become more complicated and more serious. I'll explain a bit further more. Example, if the virus spread throughout the whole body, if it affects the digestive system, you may present with nausea, you'll present with vomiting, you'll present with diarrhea as well. Moving on next, if it goes to your muscle, the virus causes muscle inflammation. That's why you feel very fatigued, you feel your muscle and joint are in pain. And the next place that actually most of the time that we are worried about the effects is your central nervous system, meaning to say your brain and your spine. When the influenza virus gets into those areas, you are worried about brain inflammation. You are worried about spinal complication and nerve complication. So those people will have symptoms like seizure. There are symptoms like what you call it, weaknesses, severe vomiting, blurring of vision, stuff like that. And the next place that we are also worried where this virus may affect is your heart or your cardiovascular system. The influenza virus or flu can actually causes inflammation or swelling of your different layers of your heart. When a person have that, they have difficulty in breathing, they have chest pain, and the blood pressure drop, it can be quite serious as well. And one of the most common complications that a flu flares up is a pneumonia, you have lung infection, and all your respiratory tract up the way to your throat may be fully inflamed. They get swollen up to the point it's quite serious. And one of the other things I'd like to mention, a flu also can affect a pregnant mother. A lot of studies and data have showed if a pregnant mother has a flu infection, they may go into early delivery. They will even sometimes go to miscarriage. And one of the things is actually can cause fetal or low birth weight for a baby.
OK，所以普通的流感症状有发高烧、身体酸痛、咳嗽、流鼻涕、喉咙痛。可是比较严重的病症会有脑膜炎。如果你有脑膜炎的话，可能你会有严重的头痛或者是发羊吊。这个流感也可以影响到你的心脏，导致心肌炎，那么你就会有很严重的胸口疼痛与呼吸困难。除此之外，它也可以弄到你有肺炎。如果你现在是怀孕的话，那么它也会影响到你的婴儿，可能会有早产或者是流产的迹象。How flu is treated?
When you see a doctor and you have a flu, if you notice, doctors will give you supportive treatment as a first line. Number one, if you have fever, we give you Panadol to reduce the fever and the joint pain as well. If you have vomiting, we give you anti-vomiting drugs and so forth. We call it supportive treatment in that sense. But one of the tool in our arsenal we can give you is an antiviral drug. One of the example is a drug called Tamiflu. So this antiviral is given to you to shorten your flu infection and shorten your flu complication at the same time. But however, please do note, why do we ask you to come in if early as possible to have a flu? The best time to administer or to be given an antiviral medication is the first 48 hours when you have a flu infection for it to be effective.
So 针对这个流感的治疗，我们是针对病人的症状给予治疗的。我们通常会给发烧药来减少病人的疼痛身体疼痛与发烧的流感症状。除此之外，我们也有这个抗病毒的药物。可是这个药物我们建议你在48个小时之前使用，那么它是最有效的。How can this flu be prevented?
Very simple. Whatever you're doing during the COVID-19 times, we apply the same. Number one, practice good hand hygiene. Practice good personal hygiene. So wash your hand frequently and avoid in contact, especially those who has the flu, because it can be transmitted to you when they're coughing and the surrounding areas may be infected with those influenza virus as well. And after that, most important thing, try not to rub your nose a lot if you have the flu symptoms. Isolate yourself so your loved ones or your close immediate friends or relatives are not infected with the flu virus as well. And if you have flu symptoms, please seek and see a doctor as soon as possible so we can administer or we can prescribe you the antiviral as needed. Lastly, the best way to prevent a flu is actually getting a flu vaccine.
So 最有效的预防流感是注射这个流感的这个疫苗。除此之外，个人的卫生整洁。如果你有症状的话，尽早看医生尽早看医生，然后自我隔离，以避免把这个病毒散播。What is a flu vaccine?
The flu vaccine is pretty much contains strains of flu. Part of it is to help you to boost your immune system to protect you from getting flu. There's various types of flu vaccine in the market, but in general, most of the flu vaccine nowadays have 4 types of flu virus in them, or 4 subtypes we call it. Usually they have 2 types of influenza A and 2 types of influenza B virus.
OK， 所以我们的流感疫苗其实都是含有4种最流行的流感病毒的组合。通常我们的这个疫苗里面会有2种的 A 型流感与 B 型流感。What are the benefits of flu vaccines?
Getting a flu vaccine is not just like prevent you from getting flu, but if you can see on the screen, In 2017 and 2018, and this is just the data from US alone because they really monitor their flu outbreak because it's a pandemic there during the flu season. So in 2017 and 2018, you have 45 million people are affected with flu, and out of that, it became the flu became serious, and 800,000 are being hospitalized or they are admitted for further treatment. And out of these 800,000, it's unfortunate that 61,000 of them lost their lives. So when they went back and see those people that get the flu vaccine, they found out 6.2 million people are being free from getting a flu when they get the flu vaccine. And out of that, 91,000 people are prevented from being hospitalized. And with the flu vaccine, they prevented 5,700 deaths. So this is why we want to get your flu vaccine so there's no complication and we can live healthily.
OK， so 根据以上的图表，流感的疫苗大大的减少了我们流感的症状，减少了必须进院的可能性，也大大的减少了这个流感的并发症与死亡率。So are there any side effects of flu vaccine?
Usually, there is no side effects for a flu vaccine. It's only a small percentage or small number has it. Some of them may have just a mild fever, but they resolve in a day or two. And a small proportion of them may have pain over the injection site, or a bit of muscle pain, and fatigue. And rarely they have any serious side effects.
流感疫苗通常只有非常轻微的副作用，例如稍微的发烧，在注射的地方疼痛而已。Who should take flu vaccines?
On the current recommendation, Tracy, I would actually recommend anyone that is 6 months old and above to get the flu vaccine. It's because of the flu season. And of course, the more focus group that I would actually highly encourage and highly recommend to get a flu vaccine is those are elderly, those pregnant women, children, and those people with chronic diseases or immunocompromised should get the flu vaccine.
Okay. So 由于流感是季节性的，所以我们建议全部超过6个月大的人都需要注射这个流感的疫苗。比较高风险群的人有老人家、怀孕的女士、儿童，还有那些有慢性疾病或者是免疫系统比较差的人。Okay, now we have a few questions from the viewers.
Sure.
So the first question, how come my doctor asked me to get a yearly flu shot?
Okay, as I explained earlier, that we have a northern and a southern hemisphere in this world, and the northern hemisphere is talking about countries like in the States, North America, and the southern hemisphere are those in Australia. And these viruses or flu virus, they change their form every single year. So what do we do to identify these common strains? Every year, twice a year, the viral expert will gather data from all around the world and present it to WHO to identify the 4 most common strains. And once they identify the 4 common strains of virus, they'll pass it on to the vaccine manufacturer. And from there, they will give the flu shot. Again, why is it yearly? It's because the virus changes its strain every single year, and every single year, the 4 common type of strain may change depending on the season.
Okay, so 流感最特别的之处就是我们的流感的病种会每一年都改变，它会根据季节性或者是地方而改变，所以每一年我们的专家都会收集一些资料，然后会推行最流行的4种疫苗的组合。What are the emergency warning signs of flu sickness?
Again, as I mentioned earlier, most of the people that have flu vaccine, they are not serious. But when it becomes serious at time, like mentioned earlier, the different system that may be involved. So for example, if you have difficulty in breathing, you need to come to us early. Any tightness in your respiratory tract, coming to us early. If you have severe headache, severe vomiting, you have any fainting, any seizure, chest pain, those are the things we call it emergency warning signs. Do come to us early.
OK，所以如果你有呼吸困难或者是胸口疼痛，那么你要马上过来医院接受检查，因为你有可能是染上了这个流感的并发症，例如肺炎或者是心肌炎。除此之外，如果你有很严重的头疼，或者是很严重的呕吐，或者是发羊吊，那么你也是必须马上来医院接受治疗，因为你有可能染上了这个这个脑膜炎。So anyone shouldn't take flu vaccine.
I think everyone should take a flu vaccine, but there's this small group of people that we usually ask to avoid. One of them, anyone with a history of having a very severe or serious allergic to flu vaccine. That should be taken. Number two, anyone have a history of allergic to eggs, but however, there's currently a third generation of flu vaccine that reduces this risk. So anyone with allergic to egg also are encouraged to take flu vaccine. So these are only a group of people that we should not take. And of course, the last one I forgot to mention, anyone that's below 6 months old, because at the moment, an infant below 6 months old, there's no data or no research on flu vaccine on them.
Okay. So 除了小过6个月的婴儿，基本上我们都是建议他注射这个流感的疫苗。可是除了那些曾经对这个流感的疫苗有过度敏感的症状，那么他们是不适合接受流感疫苗的注射的。可是在最新的流感疫苗的推行，其实已经大大的减少了大家对这个，如果你有对蛋有敏感的话，其实最新的这个流感疫苗已经大大减少了这个副作用。How long does it take for flu vaccine to work?
It takes 10 to 14 days to be in effect for the flu vaccine to work. Wow, from the time you get yourself jabbed.
Okay, so 流感疫苗需要大概1周与2周的时间才能在我们的身体发挥功效。How come I still get the flu infection despite being vaccinated?
I get a lot of this question as well. As I mentioned earlier, your flu vaccines contain 4 types of flu strain. So you are protected for the 4 types of common strain of flu during the pandemic season. However, there are different type of other types of viruses that cause similar like flu-like symptoms. You have your avian flu, you have your parvovirus, you have other subtypes of flu virus that may also seems like a flu, but it's not the influenza virus that you are being vaccinated with.
Okay, so 我们注射的流感疫苗其实只含有4种的流感病毒的组合。所以如果你感染的流感疾病其实是以上4种的以外，那么你当然还是有机会感染到这个流感的症状。So I'm allergic to egg. Can I still take the flu vaccine?
Yes, you still can take the flu vaccine even you're allergic to egg. Like I said, currently there's a 3rd generation flu vaccine which reduces the risk for this group of people. So those people are also encouraged to take the flu vaccine and it's relatively safe as well.
所以现在我们有这个最新的疫苗，如果你是对鸡蛋有敏感的话，其实这个你拿了这个流感疫苗过后的那个敏感症状已经会被大大的减少了。So last question, I travel often to both US, Europe and also Australia. What are my flu vaccine recommendations?
Yeah, Tracy, I get that question a lot. I think this probably come of those people that travel frequently or travel a lot around the world. Like I said earlier, you have different times of a flu pandemic or flu season, we call it. So the US and Europe, we call that Northern Hemisphere, and the Australia, Southern Hemisphere. So that for people that actually travels a lot, by recommendation, it should take two flu vaccine in a year. So you should talk to us, or you can contact us if you want to, or you can talk to your physician, because every single year, the Northern and Southern Hemisphere, the virus will be updated on a constant basis. But again, there are certain times where the both Northern and Southern Hemisphere recommendations are the same. So in that particular year, if the data shows that it doesn't have needed to change or to be updated, that time you only take 1 flu vaccine. But however, most of the time, the recommendation is a bit different because the Southern Hemisphere usually will change their two influenza B viruses. So it's best that you talk to your doctor to get the latest update. If not, you can contact us to get the latest update if you are traveling a lot, and we will advise you which vaccine you should take at which time of the year as well.
OK，so 以上的地方都是两个不同的地方，是在北半球与南半球，而且在不同的地方的流感季节是不同的，所以我们需要更新不同流感季节的那一个疫苗的组合，所以我们最好的建议就是，当你有要出国旅行的时候，最好是向你们的医生寻求最新的疫苗的更新。Okay, so I thank you, Dr. Ben, for sharing with us
Welcome.
regarding the influenza vaccine. So this is the end of our FB.